All right, we are back. Sport and Spinal Weekly in the studio with us, Dr. Erickson. We will be speaking with Choice Therapy here later on in the show. But today we're talking back pain. And even though it's two words, one topic, it's pretty broad.
It's pretty broad, but it's something that just a ton of people experience.
Mm-hmm.
In fact, there's been a lot of studies done that show approximately 80 to 90% of the population will experience at least an episode of back pain at any given time.
Well, you would think. I mean, you'd have to live under a rock, but then your back would probably hurt.
And you'd have back pain.
Yeah. But yeah, I mean, I can't imagine anybody that hasn't had something.
And there are some, and I do a lot of public speaking to different groups in the community, and I always ask that question. Show of hands, who's had back pain, and it's pretty consistent. It's 80 to 90%. There's always one or two that they've never had back pain, and
really,
I don't know why. There have been some studies done that show degeneration of the spine, which ultimately leads to back pain, or can lead to back pain. Has a large genetic component, and so if you have a family history of back pain, you'll likely experience some back pain. But back pain affects a lot of people, and there's a lot of different treatments for back pain out there, not just chiropractic. Chiropractic's been shown to be very effective in treatment of back pain, but there's some self-treatment too. Obviously, you can take over-the-counter things.
That's not a treatment, though, really, is it?
Well, I mean, a lot of people consider it as I guess it's a way of dealing with, with your symptoms, but it's not a true treatment.
But the problem does go away. I guess what I was saying, the pain might
it's
be less for a while.
Typically, the source of the problem doesn't go away if you take a medication just to cover that up. Now, that medication, may knock down the inflammation or reduce the inflammation in the spine if there is some inflammation causing the pain. But what caused that inflammation in the first place, that's kind of where, from our chiropractic perspective, we like to find out the root cause of what's causing the problem, and then we can find a way to treat that.
Well, now, you see, I remember when I was growing up, Dones for your back, or remember that Dones pills?
Sure, yeah.
Now, is that? I guess I didn't understand. How does that work? I mean, is that pill knows to only work on your back, or what's the deal there?
Well, and now obviously there's a lot of other companies that obviously they have Tylenol for the back. And,
okay, sure.
And Advil back pain medication, and so it doesn't just go to your back.
Okay.
But it's obviously a great marketing tool, because obviously companies like that have realized, hey, a large segment of the population experiences back pain. That's a good place to market to. So is it separate than a
pill for a headache or an aspirin?
I don't think so. I mean, I don't know if it has some different properties. It may have some. I don't know offhand, I guess, but it may have some other. Some other supplements involved with the main core. But I mean, if you're going to take,
but it's not fixing nothing.
If you're taking no, it's not. If you're taking Advil, I mean, the major component is ibuprofen, and Tylenol is acetaminophen, and so I mean, that's the same. And there might be some little things in there, but again, it's not. It's kind of covering up the cause of your back pain, and where we like to be, more active with treatment, and not. And not kind of cover up symptoms.
But like if you don't have a lot of back problems and you're out working on the garden, next morning you're kind of sore and something is pain, then I guess that'd be okay. Take an Advil or something and see if that helps. If it does, well. But if you continuously have a pain or something that's slowing you down, that could be a number of things, right, doctor?
Well, it sure could. And one of the things that you don't want to do too is, if you have what I would say normal muscle soreness, just like you described, obviously you're not going to run into the doctor's office or the chiropractic clinic because you're a little bit sore from doing something that you knew made you sore, because that's a normal thing.
Sure.
But if that's lasting more than a day or two or three, and you're, everybody knows their body. And if your body's telling you, hey, something, this just doesn't feel right, or it's, this is that something's pinching in here. There's a difference between kind of a muscle soreness and I would say, your back being out of alignment or pinching, or the back is out, the common terminology. Those are things that you want to address and take care of, and not kind of let go and cover it up and continue to cover it up. As far as taking something for, muscle soreness and whatnot, I usually don't recommend it, because pain and stiffness or whatever you're experiencing is your body's way of telling you, hey, there's something going on here. So if you're taking that stuff to cover up those symptoms, then then you're really you're kind of missing the boat. Even if it's just general muscle soreness, because why would you want to cover that up? I mean, that's your muscles are sore for a reason. Yeah, they got to work through. You're better off doing natural things, drinking a lot of water. Doing some stretches, stretching out before and after the activities, things like that are gonna help you. Ice is often effective, and those things aren't going to have the side effects, of taking a medication for your problems.
Well, and you're not getting anything. You're not really getting a solution to your problem, right? But you see you guys, and you're going to give them some options and kind of give them the insight. What's going on?
Well, that's the thing is when you go get checked out, if you come into our clinic, at least you're going to get a good exam. We're going to find out what's going on, put you through a fairly rigorous orthopedic and neurologic examination, and it's going to be very thorough. So we're going to be able to pinpoint exactly what the problem area is, and then once we identify that, we can say, number one, we ask ourselves, can we treat that? Is that something that that we can treat? And if it's not, we'll refer you to someone who can. And if it is, we'll certainly put together, give you some different options of treatment. And we certainly have a lot of different, that's the one nice thing at our clinic, is we have a lot of different options for treatment. Number one, we have 3 doctors there.
Right.
So we get good viewpoints from all of us. We all work together. We do the same thing, but we share, case histories and whatnot if we have questions on things. And then we certainly have a lot of different treatment options, including spinal manipulation, the chiropractic adjustment, if you will. And then beyond that, we have so many different ancillary procedures or procedures that can help that. So,
and the tools and equipment that you have. When you guys you do the first consultation. Now I've had had a consultation or reviewed, and you guys have computer stuff where you scan people's body. Is that part of it?
Yep, that's part of it. And so we use those are all little tools that we use to kind of put together paint a clinical picture and to find out exactly what's going on with the patient and what kind of needs they have, and then what kind of treatment we can provide for them.
Because I was just kind of shocked because, you always just think when you go to, they're going to poke you and prod you and bend you and twist you.
Yeah.
And then you get out the computers and you're scanning bodies and you're like, wow. So you really get to more than just which is all important, I'm sure.
Yeah, it's all, piece of the clinical picture or puzzle, if you will, to find out what's wrong with people. And I had a patient just today who was having lower left back pain, just classic, but she also had pain down into her outside of her leg and all the way down like to the calf region.
Okay.
And so she had been to other providers and other doctors and therapists and whatnot, and everybody kind of focused on her back. Well, it was partly her back, but also her muscles were affected then too. And so she had a lot of muscle spasm and trigger points down into her leg. And so when we addressed her low back pain along with the muscle component of her leg, and by working on the two of those together, she's feeling 90% better. And she's had it for years. And it wasn't that nobody cared about it. It was just maybe nobody else kind of took the time to identify that and say, hey, these two are maybe linked together, and then do that work on there. So there's lots of different ways to treat back pain and back ailments, and that's, I guess, one of the things that we take pride in our clinic is we take a whole body approach and look at the whole musculoskeletal system.
Do a lot of patients think that sometimes they're just sore and they really have a back problem?
Oh, for sure. And one thing with pain, if you have pain every day, you don't even notice it anymore. I mean, it's just another day of pain. Or headaches are a great example of that.
True.
And back pain is too, or upper back, like stiffness across your shoulders. Thousands of patients over the years that have had that, and when you ask them, do you have upper back pain or stiffness, and they'll say, no, not really. And then we start doing our exam and we identify those areas, and they're like, oh yeah, you know what, that has been sore, or I have had that, but I've had that for years. And then we work on them a few times, and all of a sudden they don't have it. And then it's like, wow, I can't believe that I put up with this.
You just gave me back 10 years, Doc.
Yeah, I can't believe I put up with this for years. And so that's you're exactly right. When you have pain, constant pain, you just kind of become immune to it, or you get used to it, and you think, oh, just another day with pain. Here I go. So, and there are ways to overcome that and not have to put up with it, because it does affect your overall life and lifestyle for sure.
I'm sure not all, but are a lot of back pain and problems preventable?
You're exactly right. Not all of them are, because you are going to have the injuries, the lifting and that. But again, if you're lifting properly, those are preventable.
Or like a car accident.
Or a car accident. Certainly those are, they maybe are preventable, but I mean, if you get hit from behind, that's hard to prevent.
Right.
But a lot of it back, like injuries, are preventable. And prevention, in my opinion, just like going to your dentist regularly,
True.
or brushing your teeth and flossing, you should go to a chiropractor, get your back looked at on a regular basis, and just like brushing your teeth and flossing your teeth, like the dentist will tell you to do. We tell you to do some core exercises and some pelvic stability exercises, some exercises for your back that's going to help prevent back injuries. So it's really.
And how long does it take to do those exercises?
Oh, you can do just a 5 minutes probably.
5 minutes.
Yeah, I mean, if you did them 5 minutes in the morning and 5 minutes at night, it would help you out tremendously to just do some pelvic stabilization exercises.
No, talking over the last, nearly 8-9 months, but, I guess what I was trying to get to is being preventable and, not having bad posture, and you said drinking water. Is that part of it, too? Sometimes we're just not living a good, healthy back?
Well, for sure, and obviously your back is made out, the main components of your back are your vertebrae, and then your discs, and then your nerves. And the discs are, they're mostly water because they're cartilage. And so a poor diet has an effect on cartilage. And, especially if you're dehydrated or things don't have the right mineral content and whatnot. So, yeah, I mean, a good overall healthy lifestyle, including, a lot of movement and using things, not to the point where you're abusing things, but using things in moderation and doing those normal things. A healthy lifestyle. Weight loss is huge. I mean, you can imagine.
Sure.
If you're 40 pounds overweight, look at how much more pressure is going to be on your spine. It just makes sense.
Yes. Unfortunately, gravity works that way. Huh?
It does.
Well, Doctor, thanks for the talk today. If folks have back pain or would like to figure out what their back pain is, they could give you a call and the staff and get it looked at.
That's right. Yeah, we're always open for questions. And like I said, at the beginning here today, we'd certainly do complimentary or free consultations for patients who just want to sit down and talk and see if they've got a problem, if we can help them.
Sometimes when we know more, we feel better.
That's very true as well. Peace of mind.
We'll come back and close out this show after we talk with Choice Therapy. This is Sport and Spinal Weekly on 92.1 The River. Welcome back, Sport and Spinal Weekly. Our guest for this afternoon, Joe Capon with Choice Therapy. And you guys in your new locations, I guess I have to say, because Kelly, you're still going, right?
Yes.
Okay.
Yep.
And you're in today to talk about office ergonomics. And for a minute, I suppose people are going, what is this, government class? What's going on here? But when we break it down to, regular guy terms like myself and some of our listeners, basically, what does that mean, Joe?
Ergonomics basically is adjusting the worker or the work to fit the worker.
Okay.
So we want to make sure we look at what people are doing at their job, specifically maybe at their office site, and make sure that office site fits them.
Now, is this something that is recently? Because I would assume that, ever since we've been working like in factories and stuff, there's a need for this. But how relatively new is this?
It's gotten more and more popular. Prevention is becoming more of the way to go. And it's been out for a long time. I was actually certified in ergonomics and office ergonomics about 12 years ago.
No kidding.
Yes. So it's been around for a long time. It's becoming more popular. And a lot of people are kind of picking up how to set up their work site on their own as well. So.
Now, when I think about it, I just think about the easy one where a person has a desk job and they're sitting at a computer all day, and they get 2 10-minute breaks and lunch, and that's it. That can't be good for our bodies.
That's right. One of the biggest things we look at is not only how things are set up, Oftentimes today I go into an office setup and it's set up pretty good.
Okay.
Now what we see though is people, like you just said, they're sitting for long periods of time. Our body is not designed to be in one position for a long period of time. And it gets sore, pain starts to set in, and muscles get fatigued. And so we really advocate for stretching or moving at least 30 seconds every 30 minutes.
Oh, really? Okay.
And so we'll have people set a timer on their computer. It's not that they have to get up and exercise for 5 minutes. Just stand up, stretch, reach down, touch the floor. Just get out of the position that work puts you in for a little while.
Are most employers and business owners, I'm sure if they were aware that they could get more productivity out of their employees by creating an environment that is advantageous to be productive, they would do this, right?
Yes, I think they would. They don't always understand, and a lot of people are under the assumption, both employees and employers, that one size fits all. Here you go, Mark, here's your desk, and you sit down and you start working, and you have some aches and pains, and you're not sure if this is just part of the job, but oftentimes there's little things we can change that make a big difference.
Because if we're not feeling good, we're not going to be productive employees for our boss and our employers, right?
That's right. Blood flow, just getting yourself moving, keeps you awake, keeps you alert. Someone's sitting at their desk for 3-4 hours at a time and they haven't gotten up and moved. It's amazing how just getting up and reaching up towards the ceiling just clears your head, and you think quicker, and like you said, your productivity goes up. Because of that, we often look at people's workflow and we try to think about not maybe setting everything up right in their reach, but make it so they have to get up, move,
okay.
Go outside the door to get their copies, put their garbage can across the room or the coffee pot or something like that.
I know that in some, our world, we're getting into that convenience thing where I think we've had a couple rules around here. If you're in the building, don't email, don't call, go see them. Just because you're going up and down the steps or moving around a little bit.
That's right. And actually, in today, things have kind of changed. They're starting to look at some sit-stand desks where you do part of your day sitting, part of your day standing. There's some new inventions out there with treadmills where your desk raises and you stand and walk at a treadmill throughout the day while you're on the computer. So, yeah, there's a lot of new things out there looking at, again, the productivity and also from the ergonomic standpoint, decreasing the strain on your body.
Now, it's easy to go into the office environment. What are some other environments that...
I work a lot with other manufacturing companies in the area.
Okay.
If they have a certain job position or site that's causing injuries, we'll go take a look at it and see why is there excessive strain on the shoulder or back, and sometimes we'll make real simple recommendations. Sometimes they're bigger, more expensive items too, but a lot of times things are very simple. Sometimes it's just doing a certain stretch.
Now, you hear a lot, individuals, carpal tunnel, and, it's the computer, it's the mouse, it's the keyboard or whatever. Having the right equipment, will that prevent or slow it down?
It can definitely help. The biggest thing with most repetitive injuries, which carpal tunnel is one of those, is early detection.
Okay.
As soon as their symptoms arise, you want to seek medical attention through a doctor, therapist, have someone look at your work site, and make recommendations. If we catch carpal tunnel syndrome in its early stages, it's usually very treatable.
Oh, cool.
Someone comes in after having symptoms for years, and suddenly they can't pick up a coffee cup anymore, or it's very debilitating. Their recovery is often much more limited and more expensive. So catching things early, and then we can really be more beneficial for that person.
When we talk about the office environment, how important is our chair?
Chair is very important. We look at lots of different things. We look at the low back support to make sure that you have proper low back support. It's a kind of a wives' tale that sitting is easy on your back, and it's not. No. Sitting is very difficult on your back. So having good lumbar support is very important in a chair. Making sure your feet touch the floor and you're not putting excessive pressure on the back of your knees or legs helps. And also proper support of the upper back and arms so that your neck and shoulders aren't sore.
Well, it's easy. I know that I do it all the time, sitting in front of a monitor and a broadcast board, and sometimes we slouch. And I try and remind myself not to do that. Is that another one that really gets people, the slouching?
It is, and the reason we slouch is because you don't have a good chair to sit in.
Okay, this isn't a good chair at all.
Exactly. If you have a good chair with good lumbar support, it will keep you in an upright position. Okay. When we don't have good lumbar support, a good rule of thumb is when you're sitting in your chair, if you can put your arm behind, right above your belt, and there's no resistance, you don't have any lumbar support.
Okay.
And then your body, as we get tired, it wants support, so it leans and slouches. And then over time you slouch down, and then your head comes forward and your shoulders roll forward, and really sets us up for a situation where low back, neck, shoulders, everything is putting a lot of strain on those areas.
Yeah, and if you're in that position and you're staring at a computer screen, next thing you hear is... Right?
That's true. That's true. Yep. And the productivity goes down.
You know, sometimes I don't think I found myself. I get here at 4 or 5 o'clock in the morning, and you're working on the computer. It's not that I'm tired, but does it like somehow kind of makes you feel tired?
Yes. Again, it goes back to movement, lack of blood flow, lack of oxygen getting to your muscles. Eye strain is a big thing today. Looking at the lighting and your computer screens puts a lot of strain on your eyes, and then you feel tired.
Wow. See how important just being in good shape at work.
That's right.
We'll keep you in good shape at work. And the boss will be happy because you're not falling asleep and you're productive. Right. But, then that goes home. I mean, if you're at work and you're in that position all day, you're not going to feel good. When you get home, you don't feel good. You're not going to want to participate, be active. Everybody's going to, what's up with mom? What's up with dad? Right?
That's right.
And it's all at work.
And a lot of us use the computer, for instance, not only at work, but at home.
Right.
And I see people at work who have a great setup and a nice fancy chair, and everything looks pretty good. Then they go home and their laptop sitting on the card table or on the kitchen table, and then they sit there for 2-3 hours. Well, that's part of the problems as well.
Yeah, all the good stuff you did at work is trashed by. So at home, at work, make sure you're
You want to make sure you're in good position that decreases the strain on your body, and like you mentioned, moving. Get up, move, stretch, do a little exercise here and there. Helps the brain and the body.
And yeah, I see a lot of people, I don't know if it's just the trend or whatever's going on, but you see a lot more people walking at their break or their lunch around 10:20, and I talked to, just earlier, we were talking to Dr. Erickson, and I said, how beneficial is that walking? And he says, it's awesome for your back. It's a great, easy thing to do.
Yeah, in our new facility, we have a walking track, and a lot of our staff go out there for their 10-minute break, and it's great. They come back in, and they're refreshed. They've got some fresh air, and their productivity is going to go way up instead of just sitting at that computer for, 4 hours straight.
Looking forward to the next break.
That's right.
Joe, thanks for coming in today.
Yep, thank you.